Hello and welcome to Health Live at Seniors Today. If you saw the film just before we came on, and there was a face on that which was who's there with us again this week. In fact, for the third time in our health webinar series, Dr. Asha Narde. Dr. Asha Narde is a conservative dentist and an endodontist, and she has been in clinical practice at Juhu in Mumbai since 1995. She graduated from the Nair Hospital Dental College in 1990 and later did a post-graduation from the KLES Dental College in Belgavi as it's called now, in 1994. Dr. Narde is a consulting endodontist at the Center for Advanced Dentistry at the Breach Candy Hospital, and for the past decade and a half or more, she has been working alongside Dr. Rajiv Narvekar in South Mumbai. Dr. Narvekar has also been on our Health Life series. A great majority of our patients are over the age of 60, and providing optimum dental care has been her mission. She's part of the fraternity that trains young dentists in the field of geriatric dentistry to understand and provide the needs of the aging population in an objective manner. Those of you who are regular readers of Seniors Today would know that she has written the cover story for us in this issue, which I will display in a bit. And today we have requested her to speak on oral health and demystifying root canal therapy. Thank you and welcome to Health Live once again. Dr. Narde, how are you?
Thank you so much. It's been a pleasure associating with you for the past 3 years. And I think I'm not that boring that you have invited me the third time again. It's indeed an honor. Thanks to Mr. Vikram Sethi and to you and to Seniors Today and all the participants who have urged that we come back to create more and more interactions with everyone.
You know, I must ask you this question before I request you to make the presentation. One of the major requests that we have from our senior readers and attendees, and whenever we ask them as to what are the topics that you would like to take, is dentistry, and they request us to invite a dentist, and this happens, and so we invite a dentist almost every once in 4 months. Now, is this something that you see in your practice, that you have a lot of seniors who are coming in? There are a lot of complaints that are coming in, over the years.
See, the paradigm is changing over a period of time. As our aging population has become more aware about their needs, they are questioning ways and trends of preserving the teeth, trying to understand the importance. See, earlier it was an ignored thing. Like the way it was, they would continue. But now people are sitting up and asking and demanding better oral health care to preserve their teeth, because they have realized that the mouth is an important aspect of the body, because if you have to get suitable nutrition, you need to chew well, and that's from the oral cavity.
Absolutely. We have nearly 100 or attendees today attending, and that just shows the interest levels that exist for this. So without any further ado, let me request you to make your presentation, and as you get your presentation ready, as always, to a request to everyone, please watch the presentation. Don't bother about taking notes. We are recording this presentation, so you can watch it on the Seniors Today website on Monday evening with the takeaways written by a medical practitioner. So don't worry, just ask your questions right at the end, immediately after doctor's presentation is over. So over to you.
Thank you so much. I really feel humbled about this.
Yeah, we can see it. Yeah.
Can you see the presentation?
Yes, we can. Go ahead, please.
Am I audible enough?
Yes, you are audible as well.
Okay. Good evening, everybody. Good evening, my seniors, my elders. Pranam, namaste. And I am indeed humbled to see 103 participants. It's so much for me to take in. Today is World Alzheimer's Day, and I dedicate this evening to all our seniors who are heading towards forgetfulness, suffering from dementia, of family members and caregivers who are part of this journey of dementia and Alzheimer's. Now, with much ado, let me get back to our topic. So I had a chat with your chief editor, Mr. Vikram Sethi, and he told me, Asha, you talk on so many things about oral health care, but there is one thing that is still a confusion among many people, and that is, what is this root canal treatment all about? People keep saying that it is the most painful part of treatment, and many a times they would prefer an extraction to getting root canal treatment done. So can you come on to our show and explain to our participants what root canal treatment is all about? So as I keep saying again and again, oral health is a very, very important aspect of our aging elders, and keeping oral health in an intact condition in our rising population, where 8% of our elderly, that's amounting to 80 million, is what is the population like today. And this is expected to increase to around 12% by 2025. That means 1 in 7 elderly will be from our country. And somewhere along, we do not give enough priority to the oral health. We run to physicians at the drop of a hat because more than 50% of our elders suffer from some kind of medical condition, be it diabetes, be it hypertension, be it heart issues, be it arthritic issues, maybe cancer, neurologic and degenerative neurologic disorders like Parkinsonism, Alzheimer's, or bronchial issues, or maybe gastric problems. At the same time, we have 20% of our elders who suffer from some kind of depression, some kind of disability. So there is an entire medical scenario which 50% of our elderly population are facing. And amongst this is our oral health. And it is very, very important that we preserve our oral health. Today, the average life expectancy is around 72.6, and this is believed to rise to around 78.9 in another 2 decades. And to maintain our healthy dentition is very important from the structural, functional, and the psychosocial point of view. There are studies conducted, and it is shown that the number of teeth is a predictor to the mortality. That means if you have increased number of teeth, independent of the illnesses that you have, there is a chance that you will tend to live longer. So in a scenario like this, preserving our oral health is very, very important. Now, teeth are required basically from the nutrition point of view. You go to any physician, the first thing they'll say is to maintain a proper healthy diet. And this is important to maintain your bone mass, your muscle mass, so that you don't become frail as you age. Now, to have a proper nutrition, a balanced nutrition health, you need to have your mouth in a good condition, whereby that if chewing is not done properly, if you tend to swallow your food, then your entire system tends to get affected. Your daily nutritional intake tends to reduce somewhere or the other. So oral health is very, very important from these very aspects. At the same time, you need to preserve your teeth, whether they are supporting a crown, whether they are supporting a bridge, whether they are supporting a denture or a removable denture. It's very important to have your natural teeth. And last but not least, we need our teeth to have a good oral appearance. We don't have bad breath. When we communicate with our fellow elders, when we communicate with our family members, with our youngsters, our grandchildren, great-grandchildren, we need to have a good, healthy smile in place. So what are the common dental problems? I'm just building up all of this and coming to the topic as to why we need to do root canal treatment to preserve teeth. Now, as we age, what we see is that there are cavities in the teeth. Cavities are there from the time the tooth erupts in the mouth because of the kind of food that we intake, especially if the carbohydrate content is high, if the oral hygiene is not maintained properly, there's tendency to breakdown of the erupted tooth. And this continues all through life if we don't take care of the teeth. Along with cavities, what we see is gum disease. Gum disease is basically when the gums, the gingiva that attach to the tooth, starts getting loose and the bone starts eroding away, leading to conditions called as gingivitis, pyorrhea, periodontitis. As we age, there are certain age changes that occur in the teeth, the flattening of the teeth, what we call as attrition, the sides of the teeth wearing out, maybe because of a mechanical object like hard brushing, called as abrasion, or sometimes because of gastric issues where the acid secretion in the saliva is high, or because of consumption of a lot of acidic drinks, the enamel tends to wear out, called as erosion, or sometimes we tend to clench our teeth. In the bargain, the enamel wears out at the sides of the teeth, leading to what we call as abfraction. Now, most of our elders are on multiple medication, and many of these medications that are taken over a period of time can cause dryness in the mouth, which is a very debilitating condition, very annoying to the patient. Food consumption becomes difficult, maintaining the oral health becomes difficult. And sometimes when it is neglected, when either cavities are neglected, gum diseases are neglected, where in the teeth is neglected, or when there is dry mouth and there is total breakdown in the teeth, all this can become an end point and lead to edentulosum, what we call as tooth loss. It can be partial or it can be total. Also, we have a very high incidence of oral cancer in our country. So these are the problems that we see commonly in the aging population. Now, as I said, cavities leads to loss of tooth structure, which again leads to pain, discomfort, difficulty in day-to-day functioning because of either pain, swelling, difficulty in chewing of the food. Now, if you see the two pictures that I've shown you, the top one shows the chewing surfaces are affected. It is a black area. And the one below, the teeth are all flattened out, but they're totally broken down. This is actually a cancer patient who underwent radiation, dryness in the mouth, couldn't maintain a oral hygiene properly, leading to the breakdown of the outer enamel and the dentine, resulting in rapid progression of cavities. Now, gum disease, as I told you, is the looseness of the teeth because of pyorrhea, whereby the gum which is attached to the tooth gets inflamed due to the presence of loose deposits that are there around the tooth, which you fail to clean properly. There is a loss of the gum, which we call as a periodontal ligament, which moves away. The gum tends to become, it starts getting affected in the sense that the minute you touch, it starts bleeding. The tooth tends to become loose. And if proper care not taken, again, the end point is total looseness and loss of tooth, what we call as edentulism. As I told you earlier, the wear in the teeth with flattening of the chewing surface, sides of the teeth, or at the next, a wedge-shaped notch are all the four conditions that we see. The picture over here we see is a typical condition of abrasion of the teeth. This is what we see as the flatness of the teeth. Dryness of the mouth leads to the mucosa, which is the coating of the inner part of the tooth. It becomes inflamed, it becomes dry, it becomes very sensitive. The teeth tend to break down with multiple cavity because there is no salivation, so there is no lubrication around the mouth. So whatever food remains gets stuck to the tooth surface and the bacteria act on it, and there is a quick rampant loss of the enamel and the dentine around the teeth. Also, the tongue getting dry can lead to cracks in the tongue, what we call as fissured tongue. This is a picture of where all the teeth have been lost, either maybe because of cavities or gum disease. Here's some of the teeth that are lost, basically because of gum disease. Even this picture on the right, the teeth have been lost because of gum disease. And last but not least is oral cancer because of tobacco consumption, betel nut chewing, alcohol consumption, with unhygienic oral condition, and sometimes viral infections like with human papilloma virus. Now, this is a picture on the right of a patient who had oral cancer on the left side of the jaw. He lost half the jaw due to surgery, and the remaining half has been preserved to maintain the function. Now, I have told you the different conditions that we see in the aging adult. Now, what exactly are these conditions and how it needs to be preserved. Now, when you look at the picture given below, code 0, what is written on top, this is of the front tooth as the central incisor. This is an intact tooth surface. Now, what happens is that when plaque remains on the surface of the tooth, plaque means they are the soft deposits that are there around the teeth. If we do not adequately brush around these surfaces and the plaque remains at the edges over here, the bacteria that are present in the soft deposits act on the enamel, leading to a breakdown of this surface of the tooth, that is the enamel. Now and then this becomes a chalky white area, what you see as a decalcified surface. This is porous in nature, and there is more and more penetration of the bacteria and the acid that is liberated by the bacteria into the surfaces. The surface tends to become soft. So when this outer layer, the enamel, is lost, the inner layer within the tooth, which is called as the dentine, is exposed to the oral environment. That means the food that we eat gets stuck on this surface over here, on the dentine. Now, the dentine is a sensitive part of the tooth. There are fine nerve endings over here in the dentine. So what happens is that when you have something hot or when you have something cold, you suddenly feel the reaction on the tooth because the sensitive part of the tooth is exposed to the environment. Now, this surface is more softer, so the bacteria can act on it faster, result in breakdown of this surface. Now, when it gets broken down further, it penetrates and penetrates further into what we see as this cross section of the tooth. The absolute white is the enamel, then you have the dentine, and the red area over here is the pulp or the nerve and the blood vessel of the tooth. So when you have extensive decay, the black area, what you see over here, which penetrates from the enamel to the dentine and it reaches the pulp, this is the soft tissue of the tooth. That's where the bacteria enters this space over here, resulting in inflammation of this soft tissue over here, which progresses, which progresses to the tip of the root around the bone and results in infection over here. Now, when it reaches this stage is when you experience difficulty chewing, like you suddenly feel, doc, when I chew my food on this tooth, it starts hurting. Doc, when I'm sleeping at night, I am awake with severe pain. That is because the nerve tissue within the tooth, the pulp, has got infected. Now, when it is a condition like this, we cannot just go directly remove the decay and fill it up. We need to address the issue. That means the tissue, the soft tissue that is there within the tooth, the pulp, has to be removed, cleaned out, and a filling has to be put in place. And that is what root canal treatment is all about. So basically, getting to the root of the problem, that means the soft tissue, the pulp, which is infected because of the decay and the bacteria that goes within the soft tissue, it has to be removed, cleaned. This environment has to be made absolutely sterile, and then a filling material has to be placed. Now, why do we need this? Because the tooth is very important from a chewing point of view. So let us go back to the problems that I had addressed earlier. So when you have a cavity which is very extensive, doing a filling at the cavitated area is not going to help if the bacteria has entered the soft tissue. So you need to remove the decay, you need to clean out this tissue, and you need to fill it with an inert filling material. So that is why we do the therapy to protect this tooth and keep this tooth in function in the mouth. So if you look at the outer part of the root, there are fine fibers over here known as the periodontal ligament fibers, which are connected to the bone. So when this tooth comes back to a healthy state, the sensation to hot and cold is lost. But this part, the ligament, gives us the feel the amount of pressure that is required to chew our food, and the function of the tooth in the mouth is preserved. So from when you have a cavity, when it is extensive, we do root canal treatment. That means eliminating the infection that is there within the tooth, cleaning out the infection, filling it up, and also, if need be, put a crown in place, because when there is extensive decay, that much of tooth structure is lost. The tooth becomes weak. So by doing root canal treatment and putting a crown in place, the tooth becomes strong like before. So from the cavity point of view, root canal treatment is done. Now, coming from the poor gum health point of view, as I told you, when there is periodontitis, that means the gums around the tooth bleed, there is a loss of attachment. So what happens is that the bacteria enter the gum tissue and it goes to the tip of the root over here. And from this end, the bacteria enter the nerve tissue. So there are some conditions where the patient says, Doc, my tooth is absolutely intact. Then why are you suggesting root canal treatment? Well, you have extensive gum disease, which by cleaning alone doesn't help. The bacteria has entered the nerve tissue. We do certain tests to check that before we decide whether we have to do a root canal treatment along with the gum treatment that has been suggested. So from the periodontitis point of view, sometimes we do root canal treatment with gum treatment to preserve the tooth. Now, in conditions of age-related wear in the teeth, as I told you, with age, the teeth tend to flatten out. So when the flattening out occurs, this enamel is lost, this dentine is lost. So this nerve endings are exposed to the oral cavity. So over a period of time, because of this exposure to the oral cavity, this encased pulp tissue tends to become inflamed. So many of our elders who have flattened out teeth, and when they go to the dentist and the dentist looks at the tooth and says, your teeth have worn out and you need root canal treatment. Again, you wonder, I don't have cavities, but then why am I suggested this treatment? So instead of extraction, to preserve the teeth, again, by removing the tissue that is there in the canal system, we clean, we put an inert material, we fill it up, we preserve your tooth in the oral cavity, which will help you in the function of daily chewing. So this is about age-related wear. Now, when I come to xerostomia or dry mouth, now what happens in dry mouth is that because of the dryness, this enamel, though it is inorganic and hard in structure, it tends to break down. When this breakdown, the softer dentine also gets affected. And as I told you, there is less salivation or no salivation. There is no lubrication. The bacterial count is high. The pulp within the tooth gets easily affected. So in a situation of dry mouth, many a times we see there is extensive decay, means it's not one or two cavities. Out of 28 teeth, if there are present, maybe 26 to 20, all the 28 teeth, some surface or the other are extensively involved if the patient has not advocated a good oral hygiene measure as prescribed in a case of dry mouth. So again, in situations of dry mouth, when there is breakdown of the tooth, we do not advise extraction. We preserve the teeth by doing root canal treatment, so your teeth remains in an intact condition in your mouth. It is treated and it is restored. It is a kind of an interceptive treatment to hold your original teeth in your mouth. So coming to oral cancer, many a times in oral cancer, the patient undergoes surgical treatment. Along with that is chemotherapy and radiation. Now, today modern day radiation is very targeted, but many a times we see a breakdown in the enamel and dentine of the teeth, and most of the surfaces are affected. So in a condition like this, again, when there is extensive breakdown because of cavities due to radiation, we again have to intercept and do root canal treatment to protect the teeth. So this is the reason why root canal treatment is done. And I hope I have made you all understand why and the importance of preserving your natural teeth. It may sound like an interceptive, painful procedure. When the procedure is done, it can hurt you. But again, I would like to tell you that modern root canal therapy procedures, there's so much of technological advancements. Sometimes root canal procedures are done as single sitting procedures, but many a times when you have symptoms, we do not do it as a single sitting procedure. We call you, we inject, give you a local anesthetic injection to keep you comfortable, remove the decay, remove the soft tissue that is there within the tooth, apply a kind of an antiseptic, a healing agent within the tooth, put you on a temporary dressing, call you after 7 days after the symptoms have subsided, fill up the root from within, fill up the tooth, and then put a crown in place. So yes, there are 3 to 4 visits involved in all of this, but at the end of it, it is your natural tooth that is preserved in the mouth. We do not have to undergo a radical extraction, because the minute you extract, then you have to think in terms of replacement, and replacement is in the form of either dentures or implants, so that you have either your natural or artificial teeth back in your mouth, so that your chewing can be done. And chewing is very, very important. I cannot overemphasize about that. Chewing is important from the nutrition point of view. Chewing is important because that also prevents the cognitive decline. Every time you chew, you masticate your food, the blood supply to the brain increases and the brain cortex is stimulated, and that is how the cognitive function continues. So preserving your teeth, doing root canal treatment is not just a local benefit, it also improves your cognitive function of, and which in turn is beneficial for your entire health. I'll just share some radiographs so that it is a little more clear about it. Please don't go by the technical thing. On the left side, you see a radiograph of a patient who had extensive filling. So sometimes patients say, Doc, I've had a filling done some time back, everything seems okay, and I still suddenly have had pain and I've been advised root canal treatment. Why does that happen? So sometimes our first order of treatment is always to do a filling. But sometimes, in spite of doing a filling, the bacteria are already there in the soft tissue, which can again cause inflammation of the pulp tissue, resulting in the need for root canal treatment. Now you can visualize this better. This patient has undergone root canal treatment. We removed the soft tissue from within the tooth right up to the tip of the root, and we have put an inert filling material, and the tooth heals back to its normal state. Now, many a times, many of you all have undergone extraction, and maybe to replace the missing tooth, you've undergone a procedure known as bridge work. That was taking support of the tooth in front and behind with crowns, and your function is maintained. Now, it's not necessary that every time a bridge work is done, root canal treatment has to be done. So this was a patient, she was 79 years old. She came to me during COVID. A bridge work was done 4 to 5 years before COVID. And suddenly she started experiencing pain. So sometimes there's a fine gap between the crown and the tooth, what we call as micro leakage, which leads to infection of the tooth. And the patient had symptoms of difficulty chewing, difficulty getting sleep because the nerve was infected. We cleaned out, we did root canal treatment, we preserved the tooth, and even her bridge, her old bridge, was preserved. It was a very simple procedure, a very conservative procedure of making a small hole through the existing crown, doing the root canal treatment or endodontic therapy, what we call as, and restoring the tooth back to function. Sometimes root canal treatments are done early in life. Like this patient on the left is a diabetic. So when she was around 10 years before this retreatment was initiated, the root canal was done. Sometimes when your sugar levels are on the higher side and you're a diabetic, you can have a tendency for a reinfection around the root of the tooth. So in such, this is the kind of black area which signifies the infection that was there. A scan was done to ascertain the infection. We recleaned the tooth and brought the tooth back to a healing state. So sometimes a second root canal treatment on the same tooth has to be done, what we call as a retreatment, to bring about healing. So the whole idea of doing this is to prevent an extraction and preserve your teeth in the existing condition. So these are and sometimes when there is infection which are big, what we call as cystic lesions, along with doing root canal treatment, we do minor surgical treatment to clean out the infection that is there at the base of the tooth to bring about healing. So root canal treatment can also be followed by a surgical treatment if the infection around the tooth is extensive. Sometimes trauma. These days, it's very common, especially during COVID. What we saw was inherently people sitting at home, the insecurity, the uncertainty of what the future will hold led to a lot of subconscious clenching of the teeth. And we had patients who would present to us with intact teeth that fractured maybe on the top crown part, or this was a typical example of a patient where we couldn't even see when the patient came to the clinic where the fracture had occurred. We had to send him for a scan and we realized that the fracture occurred at the base of the tooth. And then with history, we revealed that he was undergoing a lot of stress because of the loneliness of sitting at home during COVID. So these are situations of trauma. Of course, this tooth, we couldn't save it because the trauma, the fracture was deep-seated. Root canal treatment alone wouldn't have helped. So this gentleman lost his tooth. But the patient on the left, we could, because of trauma that had occurred years ago, many a times what happens is that the nerve within the tooth, as a response to trauma, tends to dry out and becomes calcified. So you can see on top a little black area, and then after that, there is no black line at all. But with modern endodontic therapy, we can navigate through these fine calcified canals, treat the base of the tooth, and bring about healing in the tooth. So I hope in this 10 minutes, I have made you all understand what root canal treatment is all about. It's not that, many a times you'll go meet friends and say, I had a procedure done and it was so very painful. And I don't know whether it's worth doing it. Should I get an extraction done? I can see many a times when you come to a dentist, you already have symptoms like when you have a hot cup of tea, the pain lingers for long, difficulty chewing, difficulty getting sleep at night because the minute you put your head against the pillow, it starts hurting. Or sometimes when you have taken a flight and gone on a holiday, suddenly up there because of air pressure changes, there is severe pain in the tooth. So when these are the symptoms, you visit the dentist. The answer is not extraction. The answer is going deep beyond doing a filling, getting into the core of the tooth, removing the infected tissue known as the pulp, cleaning it out, getting it filled, getting it finally restored with the help of a crown. And that aids in preserving your tooth in the mouth, which is very, very important from the function point of view. And when all your teeth are preserved well, you can chew well. Also, the upper and the lower teeth, the maxilla and the mandible, you have a joint over here, which is known as a temporomandibular joint. So what happens with age is that when the teeth tend to get flattened out, some of you must have seen how your lip tends to droop downwards because this fixed height between your upper and the lower teeth, where the wear tends to decrease, and there is a strain onto the joint over here known as the temporomandibular joint. So sometimes you come and tell the doc, when I open my mouth, one side hurts, I hear a kind of a click. Is that normal? Or it's very painful when I wake up in the morning. So these are situations where the wear of the teeth has occurred over a period of time, maybe because of clenching, maybe because of habits like bruxism in your sleep, you don't realize you're grinding your teeth, there is a loss of facial height. So in such situations, extraction is not the answer. We do something known as a full mouth rehabilitation, whereby we bring your teeth back to the specific height that is required. So when we do procedures like this, if the nerve is exposed, we tend to first do root canal treatment, put multiple crowns in place, and restore your teeth and your oral cavity back to function. So apart from procedures like visiting the dentist regularly to get cleanups done, getting a better understanding as to how to brush your teeth, the importance of using floss, interdental aids like a Proxa brush or a water pick to remove the food that is stuck between the teeth, understanding certain procedures beyond the general care that you do on a day-to-day basis, visiting the dentist, intercepting the problems that are there in the mouth, maybe in the form of getting restorations done, maybe in the form of getting root canal treatment or crowns done, will definitely help you in maintaining a better oral health. With this, I come to the end of my presentation so that we can have time for questions on the floor.
Thank you very, very much. I think your presentation was very detailed and as always. And, I'm sure there are quite a few questions that have come in, but of course, most questions have been answered. But before I take the questions, I want to ask you, your last slide had various recommendations that you made to people. Now, which is, brushing the teeth twice, etc., etc. And of the various body parts that one has, these messages of dental care are perhaps the most widely addressed because of the ads that come on television and in, earlier on radio, etc. How many people do you actually know, as in how many of your patients actually follow that in the true sense? But brushing the teeth twice, using floss if necessary, etc., etc. that you mentioned.
See, these days awareness is a great deal. If you ask me, around 70 to 80% of the patients do follow it because they have already undergone different kinds of problems and they want to preserve it. And nobody wants to keep coming back to the dentist. Like I always tell my patients, be it a child or an adult, I said, my job is to, do the whatever, suppose there's a cavity, I fill it up. Suppose there's a root canal, I do the root canal treatment and I put a crown in place. But if you do not adequately take care, you will have the next set of teeth having similar issues. So prevention from your part is so much more important to prevent any kind of further breakdown of the teeth. And I think once they undergo this entire thing of visiting us 4 to 5 times, getting treatment done, they themselves have feel the importance of preserving that the other teeth don't go through the same way. So yes, there is a paradigm shift.
Which is 70 to 80% is significant.
Yes.
And I was Googling before the session, and there's something called the fear of meeting a dentist, which is dentophobia.
Yes.
And we have a question from Mr. Anil Singh. His question is, diabetic persons under medication, can they go for root canal or do they have to take some extra precautions?
So any diabetic patient visiting the physician, the first thing we always say is to get a consent from the physician to get the treatment done. Getting root canal treatment is absolutely safe, but if your sugar levels are on the higher side, the healing is impaired. So you can do the best of root canal treatment, you can do the best of cleaning. But if the sugar levels are, say, in the range of HbA1c, being a diabetic, you will surely know that 7.5 to 8, then that kind of healing is not expected. So we also supplement the patient with antibiotics to prevent any kind of infection. But if you ask me, any day a root canal treatment, even when the sugar levels are high, is absolutely fine. And if there is no other complication, the physician normally gives a consent. But we are always in touch with the physicians before we touch the patient, because it's not just about the physical aspect of doing root canal treatment. It's about the medication that is prescribed to the patient. It's about giving the local anesthetic injection. All these parameters are taken into control. Also, whether the patient is comfortable and fit enough to sit on the chair for 45 minutes to undergo the procedure.
I think I've asked you this question one of the last times you'd come here, but is this the reason, you mentioned about consulting your physician if you are diabetic, etc. Is this the reason why, people who have comorbidities are advised to undergo dental treatment in hospitals, in larger facilities where there are other doctors as well? Is that something that you recommended? Because you are attached to the Beach Candy Hospital in Mumbai.
Yes, yes. So see, as I told you, 50% of our population, they have some comorbidity or the other. In that 50%, more than 28% have more than two systemic illness, diabetes and hypertension and cardiovascular diseases being common. So in our city, especially if you see Mumbai city, the awareness of going to a dental facility in a hospital is not as much. But it's not necessary that you have multiple comorbidities. You need to visit a hospital and get your dental treatment done. You can do it in the safe confines of the clinic. But if you have certain medical conditions, like say, for example, a bleeding tendency because of blood disorders, or if you have certain bronchial issues where you need oxygen support, then such situation, or you are got certain renal problems where to undergo treatment, certain medication is stopped or certain medications are injected before the medication is done. Yes, in all such situations, it is better that the treatment is done in the confines of the clinic. Now, say, for example, patients who have certain cardiovascular issues, many a times the physician would prefer that the procedure is done in the safe confines of a dental clinic in a hospital, so that in case of an emergency, the emergency care is provided at the earliest.
Thank you. We have a question from Meenal. Question is, I have a bridge of 13 teeth on the upper jaw in 2020 due to gingivitis. My teeth jutted out, though no other problems. Now bridge has come out twice recently, and I can see the original teeth have decayed. What should I do? There's no pain, but the bit gaps in the gum and bridge.
So you have undergone an extensive bridge work and the bridge has come out. My question is that if the bridge work has not been put back, you need to get back and do it. And if you have gum disease, and today we are in 2024, so in 4 years' time, if in spite of treatment, the gum health has deteriorated and the bone support has reduced, maybe the same bridge work won't help you. So in a situation like this, if the bridge doesn't fit, or if the teeth that support the bridge have become loose, then you need to think in terms of getting extraction done, either wearing a denture or getting implants fixed in place so that you can have a new set of teeth.
Right. Doctor, we have a question which has come in from Mr. Anil Singh again. Is tooth discoloration after root canal normal?
A certain amount of discoloration occurs because the discoloration can occur because of two things. First, before treatment, if discoloration has occurred, it's usually because of trauma and breakdown of the pulp. See, the pulp and the blood vessels release certain pigments which cause discoloration over the time. Also, the teeth tend to become brittle, so they tend to look a little gray. Sometimes the restorations that are now, we don't use silver fillings. In good old times when root canal treatment was done and silver filling was put in place as the top filling, that also caused us the discoloration of the tooth, which because with modern day resin restorations, you don't see discoloration because of a restoration. So it can happen either because of the trauma where the tooth was already discolored, or it can happen because of the brittleness and the discoloration that occurred during the procedure. But it does happen.
Right.
And it is effectively treated. Say, for example, it's a front tooth that is discolored. It's not just about changing the crown. We have bleaching procedures whereby the tooth reverts and comes back to normal.
Right. Thank you very much, Dr. Narde. There are some questions that have come in, but they have been mostly addressed by your by your presentation. As I mentioned earlier, the presentation will be there on the Seniors Today website on Monday evening. I've also put the links to the last two sessions that were conducted by Dr. Narde, so you can also see that. And I'm going to request our producer to play a video of the latest issue of Seniors Today, which has the cover story by Dr. Asha Narde. And thank you very much once again for being here on a Saturday evening. And to all of you, even as we wait for the video to come in, are we getting the video? Ouch, ouch, ouch.
Thank you so much. And dear participants, I am, as always, humble. I'm looking at 108 at the end of the session also. And this means a lot to me, because I've set out on this journey where I'm a co-founder to a geriatric association. So we have an arm for community services as well as trying to create awareness in our own fraternity. So when I get motivated by seeing these numbers and I feel, okay, I'm trying to do something, and yes, it's a long way to go. And I ask you all to keep me in your prayers that the little seed that we are sowing for our country will bear fruit in time to come.
Thank you very much. And we're not able to play the video right now, but please do visit the Seniors Today website, seniorstoday.in, and you can have a look at the magazine where the video has come. So you can have the magazine, it's free of cost.
Just take a picture.
Yeah, so this was the last slide was the September issue. So do have a look at it. It is, as I mentioned, and all the issues of the magazine are available on the website, and they are free of cost. Of course, also there's the Evergreen Club. You can download the app. It's available on Android as well as Apple devices. So go ahead, enjoy the experience, and thank you once again very much to Dr. Asha Narde for writing and for being here for this session. Thank you very, very much.
I'm absolutely honored and delighted. Thank you so much.
And we will be back once again next Saturday for another session of Health Live at Seniors Today. Remember, the Seniors Have Talent, the 16th season. Yes, 16, 16th season of Seniors Have Talent is starting on September 25th. That's a Wednesday at 5 o'clock. So do remember to watch it and cheer people. And there's a host of things happening on the Evergreen Club. So do watch it, do follow it, and do download it. Thank you very much.